A ChiroSecure research update. A randomized controlled trial published in the journal Brain Science to show the effects of 4 weeks of chiropractic spinal adjustments on motor function in subacute or chronic stroke patients. This exploratory study assessed whether 4 weeks of chiropractic spinal adjustments combined with physical therapy had a greater impact than sham chiropractic with physical therapy on motor function in 63 subacute or chronic stroke patients. Outcomes were assessed at baseline, 4 weeks post-intervention, and 8 weeks follow-up. At 4 weeks, there was a larger effect of chiropractic spinal adjustments combined with physical therapy compared with sham chiropractic with physical therapy on the motor function assessment. The responder analysis suggested the improvements in motor function seen following chiropractic spinal adjustments may have been clinically significant. In conclusion, 4 weeks of chiropractic spinal adjustments combined with physical therapy resulted in statistically significant improvements in motor function compared with sham chiropractic with physical therapy in people with subacute or chronic stroke. These improvements appear to be clinically important. Further trials involving larger group sizes and longer follow-up and intervention periods are required to corroborate these findings and further investigate the impacts of chiropractic spinal adjustments on motor function in post-stroke survivors.